Today for our COVID-19 update, I can report that we have 53 new test positive cases in British Columbia, bringing our total number of people who have tested positive to 1,066. 1066. That includes 497 people in Vancouver Coastal Health, 367 in the Fraser Health Region, 72 people here on Vancouver Island, 114 now in Interior Health, and 16 in Northern Health. In addition, we're up to 21 long-term care or assisted living facility outbreaks. And I mentioned yesterday that our number of outbreaks has increased quite a bit. We had 19 yesterday, but that really there are two major outbreaks and that we have learned quite a lot from them, particularly the Lynn Valley Care Centre. And so there is a very low threshold for testing people in long-term care, both residents and staff, and even a single staff case or resident case is treated like an outbreak, or is managed very aggressively as an outbreak. And I was noted yesterday that we are no longer listing the names, but they will be available on the statement so that you know exactly which facilities have been affected so far. In terms of the outbreaks, the Lynn Valley Care Centre continues to have ongoing issues with two new cases identified, although the measures in place there are now, we hope, beginning to take effect. It just really reflects the challenging situation when you have transmission ongoing in a facility and the importance of catching these really early. For most of the other ones, it's a single person who has been identified, and the measures so far seem to be mostly effective. I will say we now have 142 test positive cases who are hospitalized around the province, and of those 67 are currently in critical care, either in the intensive care unit or the high acuity units. We have had one additional death in the Fraser Valley region, bringing our total people who have succumbed to 25 in the province. We also now have up to 606 people who have been fully recovered and are no longer requiring isolation. There was a couple of things that I have mentioned over the past couple of weeks, one of which is that we have been working on and have developed an ethics framework for our response to COVID-19, and there are several different parts of it. There's an overall framework and a worksheet or a workbook approach that allows us to address a number of different questions, and that framework is now posted publicly on the BC CDC, sorry, not the BCC, the Government of BC website, on my Provincial Health Officer website links, but under the COVID response links on the government gov.bc.ca website. As well, we posted the ethical framework around duty to care that comes out of the large framework, and one on the allocation of personal protective equipment. And that is the framework that we have been using to ensure that we maximize the resources that we have to best protect people in our healthcare system. We also are in, I've mentioned this in the past, have developed an ethical framework around allocation of scarce resources, things like ventilators. And part of that is a structure for how those decisions will be made so that no single individual clinician or healthcare worker will have to make those entirely terrible decisions on their own, that it will be done within a framework that respects the value of every individual life. That one is in the final phases of completion and will be posted publicly as well when it's ready. I just wanted to reflect a little bit on our discussions yesterday. And as we talked about yesterday, this is a very challenging time for us. It's hard to know how things are going to go. Right now, we seem to be holding our own. But without a doubt, we will get through this. We will get through this no matter what happens. But we do have a few more weeks to go. Our goal is to have these restrictions that we've put in place and the orders that we've put in place for as short a time as possible, But we also need to be mindful that we need to increase our activities in society in a way that is not going to tip us over an edge or increase the number of people who are becoming infected with this disease. So it needs to be done in a very thoughtful way, and I want people to know that we have been thinking of this. We've been thinking about all the possibilities that might happen in the coming weeks and months, and of course learning from the experiences around the globe. We are more committed. The more committed we are right now, the less those outside of healthcare will need to do later. And I think it's incredibly important for us now to maintain our strong social connections at a distance. It's one of the best ways that we can take care of ourselves and our families and our communities. And there's a lot of examples that I've been seeing over the last couple of weeks and days. And the things that make me smile and make me realize that we are going to get through this together. One of them, of course, is the 7 p.m. cheer that we get. And my neighborhood does that too. And we go out there with our pots and pans. Things like people leaving flowers and groceries on the doorstep for their neighbors, and how appreciated that is. We've been seeing young children having virtual kindergarten and virtual play dates, and I know more of the virtual teaching and learning will be happening in the coming days. Evening gaming marathons with teens. I mean, my young people in my life tell me how much they get to do stuff that before they used to have limits on. But you know what? These are the things that keep young people together too. We know there's stories of history teachers working with students to document their experiences during this extraordinary time. And I think that's something that we need to think about, the things that we're spending time on now and what this will mean for us in the future. We've seen more people with friends and family chats on using social media, using video, using FaceTime than we've ever had before. And then there's some really interesting things like the Canadian flour mills are working 24/7 right now because hundreds of loaves of fresh bread are bought on Instagram every day, which is kind of different and good for us. And there are many other examples of people doing the right thing now. You know, the other part that we're seeing is community collaboration and businesses and communities wanting to contribute. And we've had hundreds of offers of support, many of which have come into me in my personal email. Not that I've been able to answer them all, but I have forwarded them on to many of the great team that we have that are looking at what we can use and how we can use the support of people in our community to keep people safe. So we also have direct donations from a lot of great companies like Safe Care BC. And it was announced earlier today, there's now the COVID-19 Supply Hub, where we can collaborate, we can tell people what we need, and government and businesses around the province can contribute to that. So I think that's a great way for now to try and work on this together and solve these problems together. So these donations, these offers of help, and these many, many examples of community connection really do show me that we will get through this, and we'll get through this together.